Saskia Omar, student ID 20164300. And I'm doing assessment number 2 for the medication calculations. And I'm going to begin. So medication furosemide, oral route, dose is 40 milligrams and the dose in the box is 40 milligrams per tablet. So I'll be giving 1 tablet. Omeprazole per oral route, the dose is 20 milligrams and the dose in the box is 20 milligrams. So I will be giving 1 capsule. Omeprazole, oral route, dose is 20 milligrams and in the box it is 10 milligrams per tablet, so I will be giving 2 tablets. Next is flucloxacillin, oral route, the dose is 500 milligrams and it is 1 capsule is 500 milligrams, so I'll be giving 1 capsule. Next is tramadol per oral route. The dose is 50 milligrams for 6 hours. And on the box it's 50 milligrams per capsule. So I'll be giving 1 capsule. Next, captopril is the medication. It is an oral route, the dose is 12.5 milligrams and it is in liquid form. It is 5 milligrams per 1 ml. Therefore, I will be giving 2.5 mils. Next, tramadol, oral route, the dose is 50 milligrams and it is a liquid medication and it is 100 milligrams per 1 ml, therefore I will be giving 0.5 ml. Next question. Next, the medication is paracetamol per oral route in liquid form. The dose is 500 milligrams and in the liquid bottle it is 250 milligrams per 5 ml, therefore I will be giving 10 ml. Question. Next medication is cephalexin. The route is oral. It is in liquid form. The dose is 500 milligrams and in the bottle it is 250 milligrams per 5 ml. Therefore, I will be giving 10 ml. Next medication is prednisolone. The route is oral, it is a liquid medication. The dose is 10 milligrams and it is 5 milligrams per 1 ml in the bottle. Therefore, I will be giving 2 ml. Next question. I have haloperidol, intramuscular injection. The dose is 10 milligrams and in the ampule I have 5 milligrams per 1 ml. Therefore, I will be giving 2 ml. Question. Next medication is morphine. The route is subcut. The dose is 10 milligrams and in the ampule it is 10 milligrams per 1 ml. Therefore, I will be giving 1 ml. The next medication is clindamycin, intramuscular route. The dose is 450 milligrams and it is 150 milligrams per ml in the ampule. 450. I will be giving 3 ml. Next question. The medication is naloxone. intravenous route. The dose is 800 micrograms and it is 400 micrograms per 1 ml in the ampule. Therefore, I will be giving 2 ml. Next, I have furosemide, intravenous route. The dose is 40 milligrams and in the ampule it is 10 milligrams per 1 ml. Therefore, I will be giving 1 ml. Sorry, 4 ml. 40 milligrams, 4 ml. Next is intravenous fluid treatment. 2.5, the fluid order is 2.5% dextrose with 0.45% sodium chloride, 500 mils. The rate is over 8 hours. 100 over 8, 63. So on. The rate will be 63. The volume will be 500. Press start. Next, intravenous fluid treatment. Fluid order is 0.9% sodium chloride, 1,000 mils over 24 hours. So 1,000 over 24. Calculator, 1,000 divided by 24. 42. On 42 being the rate of mils per hour, volume being 1,000. Press start. Okay, the intravenous fluid treatment order is 3.3% dextrose with 0.3% sodium chloride. It's 500 mils over 8 hours, which is 42. So I will begin on 42 being the rate mil per hour, 500 being the volume. Okay, intravenous fluid treatment, gelofusine 500 mils over 1 hour. So I'll press on, I'll have 500 as the mil per hour, the volume being 500 as well. Press start. Intravenous fluid treatment, 10% dextrose, 500 mils over 12 hours. So 500 divided by 12 being 42. 42 being the rate, the volume being 500. Press start. Next is intravenous fluid treatment. 1,000 mils is the fluid order and the rate is 12 hours. So 1,000 over 12 is 84 and the drop factor is 60. Divided by 12. It's 83. question. 500 mils over 6 hours. Calculator. 500 divided by 6. 84 drops per minute. 83 drops per minute. 3. So 83 drops. $500 ml fluid order over 8 hours, and the drop factor is 20. 8 hours, 21 drops per minute. Okay, next one, 500 mils over 8 hours, and the drop factor is 20. So 500 over 12 hours times 20 over 60. Okay, normal saline 250 mils, heparin 25,000 units of heparin to be added. The rate is at 12 mils per hour. How many units of heparin are being administered to the patient every hour? 1200. Normal saline 250 ml fluid order. Additives is 25,000 units of heparin. The results of the APTT are back and the doctor has ordered for an adjustment in the current infusion rate to 1400 units per hour. On the volumetric pump above, make the necessary adjustments to set the correct infusion rate. So it would then be 14 as the new rate. Normal saline 50 mils and adding 50 units of insulin. How many units of insulin are being administered to the patient every hour? We've got 13 mils per hour. So we added 51. So 50 over 50 is 1, therefore 13 units per hour. Normal saline, 250 mils is the fluid order, 25,000 units of heparin as additives. The results of the APTT are back and the doctor has ordered for an adjustment in the current infusion rate to 1600 units per hour. On the volumetric pump above, make the necessary adjustment to set the correct infusion rate. So, press off, press on, it would be 16 mils per hour. Normal saline 250 mils, additive to 25,000 units of heparin. How many units of heparin are being administered to the patient every hour? The rate being at 9 mils per hour, then it would be 900 units. Finished. 100%. Thank you very much.